Okay, so we're going to go ahead and start things off here. We'll give everybody a minute to get logged in. We'll go over a few housekeeping things. We just want to say thank you to everyone who's logged in so far and will be joining us today. I'm here with Jim, and I'll turn it over to Jim in just a minute. But I did want to go over a few things before we get started. And I think we've got a couple slides to go over that. So I think a lot of us have really become familiar with Zoom over the past several months. And so you should be pretty familiar with how it works, but just in case, there are some features at the bottom to help you participate throughout the webinar. And if you scroll your mouse to the bottom, you should see a black bar pop up, and that will give you some options for your audio settings, to turn off your mic, that kind of thing. And then also the chat. If you have any sort of technical issues, you can raise or lower your hand to let me know if there's anything particular that you need help with as far as the platform is concerned. And then there's a Q&A section as well, and that's what we're going to reserve for questions for the webinar. So if you come up with questions along the way, go ahead and put those in the Q&A. You can select to do it anonymously. So if you want to put in a question, not have your name with it, that's fine. Or you can not do it anonymously, and we can get back to you after the webinar too if we don't cover everything. So the next thing I wanted to move on to is just to remind everybody that today's presentation is being recorded. And we will have the recording ready in about 1 to 2 days after the event. It takes a minute to kind of get that situated. So we will send that out in our follow-up email, as well as on our webinar library and on the ABC website. And then there's also a quiz for CEUs, so be sure to do that. And that will be, again, in the follow-up email. We're also going to put a link to it in the chat box later at the end of the presentation, and you can copy it out of there and put it in your URL and go ahead and take the quiz if you'd like. So be on the lookout for that. And I think that covers everything that we need to do. And I would like to turn it over to Jim. Jim is our Outreach Development Manager, and he spends a great deal of time working with our business owners, helping them to navigate the accreditation process and improving their businesses. He speaks at national, regional, state, chapter OMP, pedorthic, mastectomy conferences, as well as universities and colleges. He is our face, and he does a great job out there, and we and we are thrilled for him to be doing this presentation today, and we hope that everybody gets a lot out of it. And I'm going to go ahead and turn it over. Jim.
Great, thank you, Megan. Speaking of face, I think you've seen enough of mine now, so we're going to go ahead and put that off there. I appreciate that very much, Megan. As Megan said, I have the most wonderful job. I get to travel around the country, and I get to talk to so many of you business owners, practitioners, so many of you certifies, and just thank you so much for joining us today. Before we kick it off, we're going to do about 3 or 4 of these polls here today, just to keep us on our toes. And Megan, what I'd like to do is start off with a poll right now. Could you post it for us? These polls are going to be simple. So the first poll is, what's your role at your practice? Are you a facility owner, a manager? Are you a practitioner? Are you administration? Your support personnel? Are you a mix of different ones? If you are, go ahead and select the most one that you most will have a personality with. If you're the facility owner, go ahead and hit that. And we'll go ahead and take a look at that. Take 3 or 4 seconds, fill that in. And then we just would like to know kind of like who our audience is today. And Megan, once you get a good response, why don't you let us know, and we'll share what that is. So we have about 50% are facility owners or managers, 21% are practitioners, we have 24% administration, and 5% personnel, support personnel. One of the great things about this is, and you'll hear me say this probably a few different times, we're going to be talking about compliancy today. We're going to be talking about accreditation today. One of the things is, I go to some practices and they say, oh, our compliance, we have a compliance manager. That person takes care of all of it. I agree. That person may may organize the compliance for the practice, but compliancy is a team effort. I really want everyone, because everyone has a stake in this. Everyone has a stake in making sure that everything's done correctly and the best way possible in your business. So I just wanted to pull that out. So we got a good mix. I like that a lot. Let's go ahead and move on here. Before we get into the meat of the presentation, I want to let you know, since March, ABC has had an ABC COVID-19 update page. Now, this page, if you go to our website, it's at abcop.org. Everything I'm talking about today will be at abcop.org. We have CMS guidance, the changes that they have made. We have facility accreditation. I'm going to mention a couple of the different alterations that that department has made during this COVID virus. Certification exams, we've made alterations for that, and also continuing education opportunities, just like you're doing right now today, because you'll be able to get your CEUs from this presentation today. So there's a lot of good information on that. We update that as soon as we get anything whatsoever. So we'll go ahead and move forward here. ABC, I like to say, is like a three-legged stool. We do certification. That's the certification, your exams that you take, and that stays with you wherever you go. As long as you have your continuing education and you have all the processes, then that will go with you no matter where you go. We have continuing education. ABC does that work, and we approve that continuing education for different meetings, for different presentations and such, different classes and courses, and just like what you're doing today. And then what we're going to talk about is the meat of this is accreditation. That's what we're focusing on today. Those of you who have heard me speak before knows that validation is the key. Documentation, documentation, documentation. You can do anything that you want, and if it don't have documentation for it, you will not get credit for it, okay? Documentation is the key to validation. Please remember that. I'm going to hit that coming up a few different times today. We're going to be talking a lot about documentation. I feel the need for another poll. Megan, do we have another poll? I'm assuming we do. Okay, the poll is your practice accredited with ABC? Okay, we have three options: yes, no, or you're considering accreditation. Or I guess a fourth option that is not on here was, I don't know. Maybe you don't know if you're accredited with ABC, but if you could just take a few moments and fill this out, and I'm going to say something about this when we get the results back. So it should be just a few moments, maybe 3 or 4 more seconds, you'll be able to get that. And it looked like the results are up. 99% yes, 1% is no. All right, that one person who is not accredited with ABC, you are not a loner. I promise you that. What I was going to say is about 90% of what we're talking about here today will be good business standards, whether you're accredited with ABC, whether you're not accredited with ABC, it doesn't matter who you're accredited with. This information is going to be good, best business practices for you. So feel confident in that. And we're moving on from the next poll here. So starting with accreditation. For first-time accreditation, if anyone is opening a new practice, opening a new satellite practice, if you're doing opening your own business, first-time accreditation, you can apply for accreditation, the renewal of the process, when your facility is prepared. Please keep that in mind. Sometimes we have new businesses and new practices that will apply for accreditation. We'll send a surveyor out, an in-person survey out there, and they'll show up and they're still putting cabinets on the walls and they're not seeing any patients at that point. And it's a waste of time for you. It's a waste of time for the surveyor. It's a waste of dollars on traveling and the whole deal. Make sure you are prepared, because we're going to do our best to move you to the front of the line to get your accreditation survey done so you can get your accreditation approval so you can start taking care of your patients, okay? Now, for renewals, which is probably the majority of you, we're going to reach out to you 5 months prior to your expiration date. The last thing we want is the expiration date to hit when you are not renewed. And sometimes it could take up to the period, because if you have a surveyor, we get the survey scheduled, they take a while to get to you, then you may have a corrective action plan, and we'll discuss that a little later on. You have 60 days to respond to that. So now we're going back and forth, and that 5-month period gets very, very short. So we ask you to please apply early during that 5-month expiration period. We're going to reach out to you by snail mail, by email. We really want to make sure that it does not expire without you being aware of that. And then we are now doing something a little different. We are giving you a 4-week window to let you know when the surveyor is coming. We did not do prior to that, okay? We started that last year, and now with the COVID virus, we have had made one alteration to that. So, however, due to this year during the pandemic, We have been calling the sites prior to your survey. We've been calling you to ensure that you are open, and we're going to give you the opportunity to have the right personnel in the office. So you're going to get that information. So we know COVID-19 has hit some of the professions very difficultly. Some of the staff are furloughed. Some of the businesses may not be open every day. So we're really trying to be sensitive to that. So we really want to help you with that. So be aware that that's one of the accreditation alterations that I said we were making. So we want to help you. There's something that you may not know about. ABC has blackout dates. Blackout dates are dates that you can let us know that you will not be in the office. If you have a business owner or an office manager that is not going to be in a certain day, if you let us know you're not going to the office, we will make sure that we do not have a surveyor show up while you were gone. If everyone has different issues, you have a vacation, you have your niece is getting married out of town, something along those lines, let us know those dates. We have a form to fill out and apply with that. If you can do it while you're sending in your application, all the better. But we need to know that at least 4 weeks in advance. So fill out the form, let us know, and we will do our best to make sure no one shows up. And we'll work very hard with you on that. And take advantage of the blackout dates if you need those. So preparing for your survey itself, documentation is the key to validation, as I said earlier. The next point here, documentation must be available. I am not a surveyor, but I do go on some of the surveys, and I sit through the entire survey. I help out with the survey. I do the closing interview. I do all of the work with the survey and the surveyor itself. I have experiences where we've done the exit closing interview with the business owner, and at the end of the day, we tell the business owner how they did and we tell them whether they're compliant or whether they're not compliant in certain standards. And for an example, we were doing an exit interview, and the business owner was with us, and the surveyor said, "You are not compliant in this standard." And the business owner said, "Why? Why am I not compliant?" He said, "Well, we searched through your records and we cannot find this information." Well, the business owner came back, left the room, came back 3 minutes later and brought a stack of folders, and he said, "Is this what you're looking for?" We went through it and said, "That's exactly what we're looking for. Make sure it's in a place where it's available." And so that person now was compliant. ABC will work with you on that. Our surveyors will work with you to make sure that you're compliant. If you have an audit from, I don't know, a federal agency that comes in and does the same thing, they may not ask you for that information if it's not there where it should be. And they'll walk away, and 2 days later, you get a letter in the mail saying, "Ding, you were dinged on this because you didn't have that documentation." So documentation must be available. We want to make sure that's it. You're doing the work, make sure you get credit for it. Want to prepare your facility, prepare your staff. Let your staff know that the surveyor is coming. Let your staff know that we don't know the exact time and date probably that the surveyor is coming, but let them know that they'll be speaking to the staff. They'll be working with the staff, and they will be in your business for a good part of the day. We need to have a contact and a backup contact. This is an ABC standard as well as a Medicare CMS standard. I was in one survey, and we walked in, and the one business owner was the only employee. And there was a gentleman behind the counter, and he was wearing shorts, t-shirts, and a baseball hat. And we said, "We're here for the ABC survey." We showed him our badges. We showed him our documentation for that. And he said, "May I make a phone call?" And he called the business owner, who was in the hospital. It was towards meniscus the night before, and he was still in the emergency room. And the business owner called his backup contact, and said, "I need you to be there. ABC is supposed to come and do a survey at some point. It probably will not be tomorrow, but of course Murphy's Law kicks in, and there we are." But it worked out great, because what was happening is, instead of keeping his doors closed, he had his backup contact. We were able to get into electronic medical records through the owner on the phone with us. We got about half of the survey done before the owner even arrived at the practice. So it worked out extremely well. We need a contact and a backup contact. As I mentioned before, our surveys are unscheduled and unannounced. Now, ABC is a deemed authority by Medicare, by CMS. That is why we are able to perform these accreditation surveys. We are not Medicare. We are not CMS. We are not affiliated with them, but we are approved by them to do these surveys. We must follow their rules. And so the surveys are unscheduled and unannounced. But what I did tell you is, during the COVID, we will reach out to you to make sure we have the correct personnel at the business. So you will have a little bit of information coming in on that, and a little bit of awareness with that. The surveys themselves They're located all across the United States. We have them. They are workers for ABC. They're years of practitioner experience. They also have years of surveying experience. We meet in Alexandria, Virginia once a year. They go through every single standard to make sure that they are all understanding exactly what the standard means, and they are all implementing the standards in your business, because you don't need someone who comes this year and says, this is what the standard means, and this is how I want to see something. And 3 years later, you have a different surveyor come and say, no, 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 I want it this way. I want to see it this way. No, they are all together, and we have consistency with that. That's extremely important. And that also leads to this consultative approach. One of the things that we really pride our surveyors on with ABC and our staff is we want to help you prepare. We want to help to make sure that you pass this accreditation survey with flying colors. There are many things that we can change and fix while we are at the survey itself, okay? They want to come in and they want to help you. So just walking through the survey, we're going to do a little introduction when they arrive to your practice, just in case you don't remember how it goes. Little introduction to everyone. We're going to meet and greet and have a facility tour. We're going to just do safety checks. We're going to make sure we're going to speak to all of your employees, basically saying, what is your role here at the practice, okay? But they need a workspace to work. If you have an extra exam room you're not using, an extra admin area, something you're not using, they need an exam space, workspace for that possibly. And they also need, if you have electronic medical records, they need a monitor. The database that you're using, whether it's Opia, Futura, whatever, maybe you've created your own, or there's many others out there in the market, it takes them a minute to 2 minutes to get up, ramped up. They're very familiar with all of them, okay? They'll be requiring documents, and they'll request those. They'll request personnel files for all of the staff. They're going to request at least 10 patient records per certified practitioner, at least 10. If they're going to go through those, they may hand them back very quickly to you. They may spend more time with them. If they ask for more, that is not a problem. Sometimes if a smaller practice with only 1 or 2 or 3 practitioners, they may ask for 20 patient records. It also depends on your workload throughout the year. Do you have a lot of patients coming in? If you do, there's a lot more to choose from. So at least 10 patient records. If they go through those 10 and they ask more, it doesn't mean it's going poorly. Please don't flip out about that. They just have time to go ahead and do that. We are now required, if you have Medicare patients, we started about this 2.5 years ago, to telephone 5 of your Medicare patients. We will call them. We will ask them questions, something as simple as, I'll say, hi, my name is Jim Lawson. I'll say, hi, I'm Jim Lawson. I'm at Fred's O&P, and I'm calling to see, are you a patient of Fred's O&P? Great. Did you receive such and such device? Wonderful. How is that working for you? Are you having any issues with that? If they are having issues, what we'd be happy to do is hand over the phone at the end of the conversation to one of your staff members and say, Mrs. Smith would like to make an appointment to come back in to have this rectified. Or we will take information, if all your staff are busy at that point, we'll take that information and say, please call Mrs. Smith. She would like to make an appointment, okay? Now, as I said, we will telephone 5 of your CMS patients. Chances are we will not be able to speak to all 5. I make phone calls all the time, and very rarely do I get 5 people who answer every single time. So we'll probably get a lot of voicemails. If we don't get at least 1 or 2 callers, we're going to require to call a few more people until we do get some answers, okay? It's just something that we need to check off that we are doing for CMS. And of course, then there's going to be an exit closing interview, and I'll discuss that a little more later. Ow, I feel the need for another poll, Megan. Do we have one? Okay, so our next poll is coming up right now. And the question is, do you use of tools in the resource pack? Do you use the tools in ABC Compliance Kit resource pack? Do you use them? The options are all of them, some of them, none of them, or I didn't know they were available, or I think there could be a 5th option is, what in the world is an ABC Compliance Kit resource pack? So if you take a few moments, fill that out, and we will get the results, because I'm going to be talking a lot about the information that is in that ABC Compliance Kit resource pack in just a moment. We'll probably have the resources coming up, or the results coming up, in just a moment. Okay, here we go. Okay, we have 19% who use all of them. Fantastic. 71% uses some of them. No one uses none of them, but we had some people who said, I didn't know they were available. Great. This is going to be hopefully eye-opening for you. If you are accredited with ABC And we saw that 99% of our attendees are accredited with ABC. If you're accredited with ABC, these are for you. And we're going to walk through this ABC accreditation toolkit for you. I want to show you, before we walk through it, I want to show you where it lives. This is our picture of our website. You go to Patient Care Accreditation on our website, right here. These are the resources I'm going to be talking about right here. And all of these live right in this area. So if you get lost, always go back to abcop.org, and there they are. Or you can contact any one of us. The compliance kit itself. About 5 or 6 years ago, ABC decided to create a compliance kit, and we put together the marketing department and the accreditation team and other people within ABC, and also we got a lot of suggestions from practitioners and business owners. We've taken this information and put together a compliance resource kit. Now, if you are accredited with ABC, if your facility is accredited with ABC, this kit is at your fingertips. There's no extra charge for it. Everything here is at your fingertips. And I noticed in the last poll, there were some people who use all of them. That's great. There's some people who use some of the resources that we are applying here. Wonderful. If you have something that's working great in your business, keep it, stick with it. If you're getting the results that works very well, don't change a thing. But I do encourage you to look through the information we have and the resources we have, because you might find little small pieces here and there that you would like to take and put into your originals. So let's walk through some of those right here. The first thing we're going to take a look at is the compliance calendar. It's the new one is coming out. The 2021 one is coming out in December. If you are accredited with ABC and you don't receive it, I'm going to give you my email address. Let me know. Send me one, and we will mail out a copy to you if you did not receive one. Every accredited practice should receive one. What I'm going to tell you is there's great information in this calendar. Each month, we have a new thing to focus on with the calendar. You can do it in any order you would like. We're not telling you you must do it this way, but we're giving you good reminders. This year, maybe you want to open the resource kit and see exactly what's in here. The next month, maybe you want to focus on your emergency and fire drills and making sure you have documentation of all of that work. The next month, maybe you want to work on a chart audit. So there's a lot of information in there. If you don't receive this, once again, please let me know. We'll get you all set with that. So you'll see this cube, and this cube tells you that anything that we're talking about is part of the resource pack if it's on the screen. We have annual facility review checklist. We have billing and coding error reports, instructions to establish privileging. These are a lot of the things that we have to offer, not all of them, but if you don't have these and if you haven't had a chance to look at them, please go on our site and go to My ABC and do that, because we have 26 forms, charts, templates, and information sheets. We add more every year. I think last year we had about 23 or 22. We found good information. We had people give us good suggestions. We've created new forms and templates. Please, I encourage you strongly to go ahead and at least take a look at those if you don't use them at all. So first things first, I'm going to focus a little bit. This is the Patient Care Facility Accreditation Guide. If you do not have this, I strongly encourage you to get this. This is the updated version. We haven't changed things, but we've updated things. We've made things a little easier to understand. I suggest you read it, you review it, you revisit it. You can download it from our website, okay? We're not having a lot of state and national meetings right now in person. Generally, we carry a lot of these to the meetings. We hand out, I'm always empty because I always hand all of them out. But you can go to our website, and preferably not now while I'm talking, and you can download it. I would encourage you to have anyone who works with compliance in your practice to have a copy of it. I know people have a copy sitting on their desk. There's great information. I'm going to kind of walk through what's in this Patient Care Facility Accreditation Guide. Number one, all of the standards. There are 142 patient care standards for practices for O&P and Podorthus. There are 142 standards. If you see here, the standard, for example, AD.3.1.1, and the bold, that is the standard itself. Underneath it, we have information on basically explaining what do they mean. We have tips. This is going to help you understand exactly what your surveyor is looking for, what you need to do to be compliant for this standard itself. Now, if you take a look right here, see that cap? If it's marked with a P or an N, meaning If you are non-compliant or partially compliant with the standard, when the surveyor comes to your practice, standard AD.5, okay? It has a big CAP beside it, means if you're not compliant or only partially compliant with that standard, you're going to be required to create a CAP, and that is a corrective action plan after the survey itself. And you'll have 60 days to do that. ABC will write to you and say, this is what we need to see, how we need to see you to be compliant in that standard. And you show to us that you are compliant in that standard. And then, of course, you'll be fine with that. If you do receive a corrective action plan, that does not mean you didn't pass your survey itself. So this is in the book. One of the other things, this is the patient care accreditation pre-application checklist. This is your cheat sheet. This is what the surveyors are going to be looking for when they show up to your practice. So what I would do is I would take this information, which is in the book, download it, print it out. I would take this information, go through it with your staff, saying, do we have this? Is this in place? Have we done this? Have we done this? Have we done this? That way you're completely prepared when the surveyor shows up. You say, yes, we have done this. Here's the documentation. This is where it lies. This is what we have here. You're going to be completely prepared. This is a really great tool. This is what can you expect on your survey itself. We have good information. You're prepared in all areas. Once again, this is the areas of what your surveyor is going to be looking for, what they're going to do, what they're going to be requesting during your survey itself. And I say the guide isn't your only resource. We have these tools. We have the relevant standards tool, the compliance kit, as I'm just talking about itself, the annual accreditation task planner, the webinar library. Please don't forget about our webinars. We have our podcast library. We do a new podcast, and we've been doing it every month. I think we just hit our 30th podcast. We have a really professional host who narrates it and interviews all our special guests. Very proud of that guy. I think his name is Jim. And then we have the facilitator e-newsletter. We have the top overlooked items. Again and again, we have more and more and more information to help you prepare for your survey accreditation survey. And of course, this last little bullet is if you're with ABC accredited survey, you can get 50% off Kaler Fleming's insurance. Nice discount with that. So this is a great tool. This tool is only available online. It's on our website. It's a wonderful tool. What we do is we go through, we list all of the services and products that you're able to provide in O&P. Okay, this list on the right-hand side is a lot longer than you see here. Okay, you go through for your specific practice. Click off everything that applies to you. Go ahead, it's your relevant standards tool. Hit the create the PDF, okay, click on that. And what that does, it brings up a personal list based on your practice. So for example, I mentioned before, there are 142 standards you need to be compliant in. That's if you offer every single service and product that you're able to for O&P. There are not a lot of practices that offer every single service and product. So for example, when you go through the relevant standard guide tool and you click that, it may pull up 120 standards that you need to be compliant in. So what I'm saying is, don't waste time on those other 22 standards that we're not even going to check about, because that is not something that you're offering at your business. So just focus on the standards that apply to you. It's a great tool. If you haven't done it, please go right ahead and do it at some point. And this is the most commonly missed standards. We have a list of the most commonly missed standards. So this is a great resource and a great tool to say, what are other people missing? What is a trend? That are we doing the same thing? And this is what I'm going to base our next bunch of slides on. Okay, so let's take a closer look at this. Number one issue that we're finding, the surveys are finding, is not understanding the accreditation standards. When they get to a practice, they will say, you're not compliant with this standard. They'll say, you know what, I'm not even sure what that means. Well, that's okay, but try to figure out what it means before the surveyor shows up by calling us. Reach out to us. You can email us. We will walk you through it 100 times, okay? We'll walk you through it 100 times. We'll answer those questions you may have. So when the surveyor does show up, you are compliant in that standard itself. So continuing with this, I'm going to spend 4 or 5 slides on this, incomplete patient charts. RAC audits, I think I'm pretty safe in saying that no one on this webinar is really enjoying RAC audits. They're ramping back up. I'll tell you, they're ramping back up. Even with COVID virus, they are ramping back up. Incomplete patient charts are one of the main reasons that we're getting dinged on RAC audits, okay? They're looking for anything and everything they can find. So what we want to make sure is your patient charts are fully documented. So let's kind of go through some of these. We're looking for missing documentation. We want the explanation. We want to give an explanation of the steps of why the patient chart is missing it. How can we do and correct this so it's the documentation is there in the future. And it's a great teaching opportunity because the surveyor will work with you while they're there at your practice, showing you exactly what needs to be in there and how to bring everything up to date. So keeping on the same line with the incomplete patient charts, we're looking for the intake and assessment, the documentation of that. We're looking for the in-person clinical exam, the patient's needs and use. Did you confirm the accuracy of the prescription? Of course you did. We know that staff did that. Is it documented? Did you formulate a treatment plan? Of course you did. Is it down there? Did you establish the goals and outcomes? Of course you did. Here's the thing. I think everyone on this webinar is making sure that all of these things are done. You're the experts. You are the professional. You're the one taking care of these patients. You're professionals. You know what you're doing. The issue is it sufficiently documented? Because if it's not, the RAC auditors are going to do their darndest to get in there and find anything that's missing or anything that's incorrect. So along these lines, for delivery and setup, here's one thing. There was an article about 2 years ago when the RAC audits were just hitting full and heavy, that about 27% of RAC audits were because of lack of delivery and setup information. Okay, that's something we can jump on and take care of. Was delivery done in a timely manner? So I asked this question when I was talking live. I asked people, was the delivery done in a timely manner? Can anyone tell me what a timely manner is? I get a whole bunch of different answers. Sometimes I get 1 week. Sometimes I get 3 weeks. Sometimes I get, well, it depends on if the CFAB is doing work with us. And well, all of those answers are close to being correct. But I think the most important answer to this in a timely manner is, what have you discussed with your patient? If you know there's a backlog on something and you know the device is not going to be ready for 3 weeks and there's something you can do to help the patient in the meantime, that patient knows it's going to take 3 weeks and the device is prepared for them, it's ready to go in 3 weeks, that's timely manner. If you tell them it's going to take 2 days and it takes 2 weeks, well, that's not a timely manner. So it's really the communication, the relationship you have with your patient itself. Was the item or service consistent with the prescription? Once again, documenting that information. The proof of delivery, we're looking for the beneficiary's name, the delivery address, the date, sufficient detailed description of the items being delivered, sufficient detail. If you feel like you need to go overboard, go take the next step. The quantity delivered, and of course, the signature of the beneficiary or the designee itself. So how about training instructions? They're still in the patient charts. Instructions were given to the patient or caregiver. I'm sure you have done that. Is it documented? The necessary supplies to attach, maintain, and clean. How to use, adjust, maintain, clean, inspect the skin, and report problems, okay? Once again, I believe everyone's doing this. I believe every single patient is getting this information. Do your patients know how to report problems to you? They're your patient. Hopefully they do. If you go to a nursing home or go into a center where you're taking care of the patients, they may not have that at their fingertips. So you want to make sure that they have the information. How can they report? How can they get in touch with you after hours if there's an emergency? Okay. Do they have that information? Once again, I know you're doing it. Just make sure it's completely documented. So for the follow-up, did you provide follow-up consistent with the items or services? Did you review or make changes in treatment plan? Once again, I said before, you're the experts. I firmly believe you are the experts in this profession. No doubt whatsoever. You have patients who improve more rapidly or patients who are a little slower, and you do make changes to the treatment plan. That's perfectly fine, 100% fine. Once again, make sure all those changes in the treatment plan have been documented, dated, make sure it's in there. Get the information in there. Did you review the recommended maintenance? And did you solicit feedback to determine effectiveness? This is important. Of course you did it. You fit the device on the patient. They're mobile. You're working with them, and you get the feedback while you're discussing and talking. And you're getting your feedback. You're getting their feedback. That information needs to be documented. Oh, the wind just blew in another poll. Megan, do we have another poll ready? So, how often do you perform patient chart audits? Now, you will find with ABC that everything you need to do is at least once a year. At least once a year. If you do it 12 times a year, fantastic. That's great. But with ABC, it's at least once a year. You can do this anonymously. I'm not going to have any idea who answers these questions. So we're just going to get the results as a group. So do you do it at least once a year? Do you do it quarterly? Do you do it monthly? Or do you do it as needed? So go ahead and take your choice. All right, Megan, what do you think? And the results are 40% do it at least once a year, 16% do it quarterly, then we do 35% monthly, and then we have as needed is 10%. Well, I think that's great information. We got a good mix of that. I think that's really good information. This is something that is extremely important. It's extremely important with this. So let's move forward and I'll show you this. ABC, take a look at the bottom corner, the right-hand corner. That's the cube. That's the resource pack cube, okay? This is one of the tools, the patient chart audit template. We created this for you. If you have something that you use, that you love, and it works great for you, keep it. If you would like to try this, please go right ahead and try it. It's very simple, it's very basic, but it gets the correct information out. Now, I don't know how you learn. You could tell me something, and I would try to correct it. Something I was doing wrong, I would try to correct it. You may be able to tell me 2 or 3 times, but if you write it down and I have it in front of my eyes, I'm going to learn that. I'm going to make that correction. I'm going to do it well. Everyone learns differently. This will help very often. If you start off 1 month, do it. If you haven't done it before, do a patient chart audit. Take random charts, go through them to make sure all of this documentation is in that patient's chart. Okay? Write down everything that's missing. You'll see everything that you can check that's missing, and make sure those people who are doing the audits and doing the information in the patient charts see this, saying this is missing. And if you have 7 things that are missing, you pull out 30 charts, 7 things are missing, let's say. Do it again a month later. People are going to see what was missing and they're going to learn from that. And I guarantee you that list is going to get shorter and shorter and shorter every time you do a patient chart audit. We're all human beings. We all miss things, but we need to make sure that everything is in there. So please feel free to go ahead and use this tool. It is yours if you're accredited with ABC. Now, one of the big things is we have issues. We have missing or incomplete privileging information for credentialed staff. Before we go any further with this, I want to share with you, I want to make sure that everyone understands what privileging is. Now, there are states that have licensure within the United States. If the state itself has a law stating privileging is not allowed, then don't do it. It's very simple. State law and licensure trumps ABC's accreditation, okay? If the state says you may do it in one state, but not the other state, make sure you know those rules and those laws for the state. That is law. So a little definition of privileging itself. Make sure everyone understands what privileging is. Privileging refers to giving an individual permission or privileges to engage in specific clinical activities. Okay? ABC defines how a credentialed person, now a credentialed person, you must be credentialed, may be allowed under supervision, it can be direct or indirect supervision, to provide items or services outside of their scope of practice. Okay? So the privileging process is more described in more depth and detail in the ABC orthotic and prosthetic and orthotic scope of practice. And you can get that on our website, but it does go into more detail. But I wanted to give the 30,000 foot view of basically what privileging is. So let's look at this. So the staff file includes, if a person is being privileged, if a credentialed staff member is being privileged, we need a written objective criteria. That is specific information on what the work they're doing, on why they're doing the work, the education they're getting, the information they're getting, okay? And that belongs in their personnel file. We need to see what their training is, okay? It's basically the story of what they're doing. We need the justification. Why are you privileging an employee to do something beyond their scope of practice? Well, an example can be just as simple as you have a practitioner, CPO, who is doing something more extensive with a patient, while maybe an assistant, certified assistant or certified orthotic fitter is doing something a little bit beyond their scope of practice with another patient that's not as extensive. So you're being able to take care of both patients at the same time. And then, of course, we need the documentation of all of this information, and that all belongs in the personnel file of the person who is being privileged themselves. So with that, if you see the cube in the corner, this is some of the tools. These are some of the tools we've created for you. Instructions for establishing privilege criteria. I know a lot of practices use privileging. It can work very beneficial to your practice itself if you would like to do it, okay? We also have a privileging guide, basically the how and the who of privileging itself. This is very good information if you are privileging. With that, we also did this. We created another template. This is an individual privileging record template. So as you can see, we have the name of the employee, Keisha Williams. The supervisor is on there, Maria Perez. We have the date, what they are privileged in. That's very specific. Privileged in the device, the specific device they're privileged in, and their experience. Now, just as with any certification, they're going to also need continuing education with this, okay? The training can be in-house. The training could be they've worked with you as the practitioner for 3 years and you have trained them how to do that. That's fine. But I do want to remind you that with privileging, the buck stops with the supervisor, okay? Everything falls under the supervisor. And we'll talk a little bit about that here. So speaking of supervisor, what is your responsibility, okay? The credentialed supervisor must review the notes in the patient's chart, okay, that the privilegee put in the note. They must co-sign the patient's chart, and they must date it within 15 days. Now, I want to ask you a question. Today is Wednesday. What did you have for lunch last Friday? I have no idea what I had for lunch last Friday. If I sat down and spent 10 minutes, I probably could figure it out. But I think personally, 15 days is very luxurious. It's a lot amount of time, okay? I know business owners and I know practitioners who say, if someone is being privileged, I check those patients' charts every single day. Or the patient doesn't leave until I check, co-sign, and date that patient chart, okay? I just urge you to be cautious about it and be fully aware of everything that's going on underneath you, since you would be the supervisor itself. One more poll. Megan, what's our next poll? So, how do you offer patient satisfaction surveys? This should be a simple question because I know every single person listening, right, is offering them. So how do you offer them? Do you have a hard copy? Do you do it by mail, electronically? Do you do it in person? Do you use a combination of methods? Do you have something, possibly another one, that something we're not listing, something that you have created and you're doing something along those lines? So go ahead and take a few moments, fill out, how do you offer patient satisfaction surveys? If you do it in more ways, go ahead and hit the last button there, the last little bullet. I'm very curious about this one to see how I always enjoy all the answers for this. So the results should be popping up. So 9% are using hard copies. 6% are mailing them out. 17% electronically, 22% in person. And I love this last one. 46% of you are using a combination of different methods. I love that because, let me tell you, know your patients. Know your patients. I travel about 40 to 45 weeks a year. If you give me a hard copy of something, it's probably going to go in my backpack or my suitcase, and it may stay in there for about 3 more months until I go, oh, shoot, I should have done that. If you give me a link or something, I will fill it out while sitting in the airport. I'll do it on my phone. I'll do it on my watch. I will fill it out for you, and I will return it to you. My father was a vice president of Structural Steel Corporation for about, 40 years. Over the last 20 years that he was vice president of the corporation, he had an email account. My father never opened an email in his life. He just didn't do it. That wasn't his thing. Everyone who he worked with knew that, and they'd work around that. I'm not saying that's a great thing, but know your patients. If you have a lot of geriatric patients, they may not all have email addresses, or they may not all feel comfortable with doing electronically. So you can do it a bunch of different ways, and I love seeing that. And I'm going to move a little closer into it, and we're going to talk about that right here. So the patient satisfaction surveys, I will tell you right now, Medicare does not have it in black and white, but I sit on panels with Medicare representatives and I talk to them a good bit. They would like to see 33% of patient satisfaction surveys returned from all of your patients. They would like to see a minimal 33% number. I think that's hard. And if you're getting 33% or above, blessings to you. That is wonderful. Good for you. You're doing something right. Let's talk about a few things that maybe will help you. Okay. They need to be accessible. Okay. Those whose 46% said they're offering different ways, that's great. Those who are not, think about offering different ways. Think about how doing it. Make it accessible, how the patient would like to use it. Okay. Make them relevant. I have seen patient satisfaction surveys with 48 questions on there. Did you enjoy the coffee we offered in the lobby? That's a feel good, that's really nice and everything, but is that really important to your business, okay, for the patient themselves? Make them timely. About 3 years ago, I talked to a business owner who said, we mail out patient satisfaction surveys at the end of every month. So every patient who came to our practice that month, we mailed it out. Well, go back to what did you have for lunch on Friday, okay? We forget things. We don't do things. Getting in the patient's hand or speaking to the patient, however you provide this service, timely, make it timely, get it to them as soon as possible. Now, I have this last little thing right here, explaining the importance of it. Why do we do patient satisfaction surveys? Why are they required? And you probably can answer because ABC says we have to. Yes, that's true. That's a standard. But get rid of that, okay? What's the main reason we do these? Businesses offer satisfaction surveys all over the place. You can go to fast food restaurants and they're sitting on tables. They're all over the place. There's got to be a good need for these and a good reason for these. I believe that patient satisfaction surveys in an O&P practice, and a pedorthist practice, and a mastectomy fitters practice, I believe that they're there to be able to learn how to offer the best patient health care to your patients. How can we improve? Okay, so if you take a few moments with your patient and say, I'm going to give you a patient satisfaction survey, and if you could take 3 or 4 minutes and fill that out for us, we would feel great about it. We would appreciate it greatly. We want to make sure that you feel comfortable. If you see someone in church who has an issue, if you see someone in your family who has an issue, that you feel extremely comfortable sending them to our practice. If you just take a few moments to fill it out, we would greatly appreciate that. If you ask me to do it that way, I would do it. Put it in your own words, but go ahead and try that, okay? Along the lines, you see the cube here. Here's more tools we've made. How to write and analyze patient satisfaction surveys. Good information in here. We also created a sample patient satisfaction survey. Now, if you like yours, as I mentioned before, stick with it. If you don't like yours, take ours. Take it. It's yours. Put your logo on it. Put your address on it, logo, and it's yours. Or possibly, if you like 4 or 5 questions or 3 or 4 questions out of ours, steal those questions. Put them back into your other original. It's all yours for the taking. So now the patient satisfaction surveys are all coming back in. They're rolling back in. You're getting 50%, 75%. It's going great. What do you do with them? What do you do with them? First thing, extremely important. Evaluate the responses. Read them. Please read them. Have someone on staff read them. If there's an issue, you want to take care of that issue, but evaluate the responses. Bring them in, okay? With ABC, at least minimally, at least once a year, you're going to need to create a report from the results and an action plan. The report can be something very simple as this is the results this is what we're receiving, this is the scale that we're using, this is the graphs that we're using. This shows us what our patients are saying. Okay, an action plan can be also simple as well. An action plan can be, let's say you're hearing from your patients that you're not returning your phone calls in a timely manner. So an action plan can be, we are now implementing a plan that we are making every effort to return every business call by noon the next business day. That could be the action plan. If that's what you're receiving information from your patient satisfaction survey results, then there's your action plan, okay? Make sure you document it all, because the surveyors, I will tell you, the surveyors will be looking for that documentation with that. If there's a problem, I'm going to ask you to reach out and try to rectify it. Now, these surveys can be anonymous, and if someone decides not to put their name on it, then we need to respect them. It may be a complaint, it may be a positive thing, but we need to respect them, okay? Chances are, if it's a complaint, you probably know who that patient is already. If the person has their name on there, reach out to them, try to rectify that problem. There's a possibility you may never be able to rectify the issue. Everyone's had patients that will never be satisfied. That's okay. That's not a problem. At least you have made the effort. You're communicating with that patient. You're telling them you hear them, and you're working with the patient. It's a great learning opportunity with staff also. You're getting information in, share that information with staff. How can we do better? How can we improve? And it's a good marketing opportunity as well. I've used this example before. What's wrong with making up a one-pager marketing sheet saying, basically, this is what our patients are telling us. If your patients are 98% of your patients' comments are very positive, what's wrong with that, sharing that information? And who would you want to share it with? It's very simple and cost effective to make up a one sheet page and say, our patients are telling us this, 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 and this. If you would like your patients to receive the same gold standard that we're providing, here we are. Send that. You can email it. You can mail a hard copy to, who would you send it to? You would send it to your physicians, your hospitals, all your referral sources, your VA, anyone that you possibly could receive patients from, and they could give that information out. So the cubes here again, guide to patient satisfaction trend. Good information that we have available to you on that.
Hey, Jim.
Yes.
I'm just going to chime in real quick and give you we're about 10 minutes from 2.
Perfect.
And so.
Okay, great. We're going to zip through this next little part here. I just want to make sure that everyone does your fire drills, have documentation for your fire drills itself, okay? ABC has the documentation for that. It's very important. You have to do it at least once a year with all staff. Do your safety inspection at least once a year with all staff. Make sure that you have gone through and corrected any safety inspection issues that you may find, and the surveyor will look to see that you have done that, and they'll look for the documentation. These are just some photos of some of the things we found the fire extinguishers not using. These are some of the corporate documentation information that we have available to you in this resource pack. Here's your policy procedure manual. We need to update that at least once a year. It needs to be accessible to all staff. It's a living document, and we need to review it at least annually. Our surveyor will check upon that, okay? We need to make sure that your billings and claim, you have a budget. Your clinical narrative matches your billing, okay? We don't need to make sure that you're making a lot of money or just barely getting by, but it's a red flag if you don't have a procedure that if something is submitted, a claim is submitted, and it is not corrected and resubmitted, that's a red flag. We know that's not happening hardly at all, but they'll check to make sure you have that. And once again, here's a billing and coding error report, just like the patient's chart report. We have the same thing for billing and coding. Those who do billing and coding errors, or those who billing and coding, here's a place where you can put those errors down, and it will get shorter every month with that. I mentioned the exit interview. Take time with your surveyor, the business owner or a practitioner who can sit with the exit interview. If you can't do that, sit with them for that. We will do it by telephone. That's not a problem. We'll do it later on by telephone, but it's a great opportunity to get and receive information and share information itself, okay? This is the corrective action plan. If you receive this, I mentioned before, if you have some things you're non-compliant or partially compliant, you will have 60 days to correct this plan and get it back into ABC, and they will help you. Their accreditation team will help you with that. So congratulations, you have passed your accreditation survey. You want to put this on the wall where everyone can see it? What happens next? We're going to send you a press release and a news release. Send that out, share it with all of your referral sources again. We'll get this. This is the e-facilitator. ABC sends out to all accredited facilities. Please read that on that. We are on social media if you ever need us. This is our staff, a photograph of our staff. I'm lying to you. This staff is much better looking than I am. This is abcop.org. This is our website for that. This is the accreditation team. Any specific questions you have on accreditation, we're going to ask you to reach out. This is Tammy Richards, extremely knowledgeable in accreditation. They all are. She's the Director of Facility Accreditation Services. Christine Michael is the Manager of Facility Accreditation. And Kyle Sins is the Standards Compliance Specialist. This is their general email, accreditation@abcop.org. They all receive this email, and they decide who's the best person to respond to you. Please reach out to them. They will respond to you. Don't forget, documentation is the key to validation. Do we have any questions, Megan?
We do. We have a couple, and
Great.
let's see. So we've got one wanting to know if the patient record should be pre-selected and ready for the surveyor.
It's a great question. Great question. The surveyor will take them at random. If they're hard copy, there's a good possibility the surveyor will reach in and to the files and pull those out. And if it's electronic version, they'll just take a random from there. So no, don't pull anything out early and have it prepared for them. They'll let you know exactly when they get there, how they would like to do it. Fantastic question.
Great. And then the other question is there a time frame for patient records pulled and the CMS calls that are made?
Excellent question again. That the time frame itself, depending on your patient load, depending on how many patients you have coming and going in your practice itself, they would like to go within the last 6 months. The surveyors would like to keep it within the last 6 months. If, for example, you have a smaller practice and you're not having as many patients, then they'll extend that to the last 12 months. Okay? And you definitely will have enough information within the last 12 months. So great question. 6 months is what their preference is, but if you don't have enough information, they'll go up to 12 months. That is not a problem whatsoever. Excellent question.
Great. We've got several more questions coming in.
Okay.
Ray wants to know if there is a COVID complaint code.
A COVID complaint code? Not that I'm aware of. I wish I could talk to you, Ray, about that. I'm not.
I'm sorry, a COVID compliant code.
Compliant code.
Excuse me.
Sorry, ABC has not created one as of yet. I'm not exactly sure what would go in that. But if you talk to Tammy Richards, who's I put her information up there, accreditation at abcop.org, she can give you more information on that, more in-depth information on specifics on that.
Okay, next, Lisa wants to know what happens if you miss a surveyor. So her office is by appointment only. So
Okay.
you can see where that could pose a problem.
Sure, I understand that completely. So if you're by appointment only, then the surveyor obviously will have to reach out while you're there and to make sure that you are there for the survey itself. And so by appointment only, they will come and they will contact you to say, this is the time we are coming. And they'll do it very briefly before they arrive. I'm not talking an hour or anything like that, but they won't do it 4 weeks ahead. They will reach out to you because in that situation, obviously, you're going to need to be there when they're there at the same time. If it's not by appointment only and they get to a practice and it's closed during work hours, well, then there's an issue with that. But in that situation, they will reach out to you. Thank you.
Great. Sue asks, safety, do fire extinguishers have to be mounted? And can they be in a cupboard under the sink as long as it's marked on the fire safety sheet and all the staff are aware?
And where they're located. Well, I think that may get into a little bit of the OSHA area, which is beyond ABC. And Sue, I don't know. I really am not sure 100% if they need to be out in the open. I would think it would be beneficial to be out in the open. One of the positive things about having it out in the open is you walk by it every single day. You literally walk by it, and that you can have a service come in and check your fire extinguishers, and they'll be great today. The arrow will be up in the green today, and sometimes they leak. And tomorrow or a week later, it'll be down in the yellow or in the red, and that's no good. So I know that, including even in my house, when I walk by the fire extinguisher, I'd say about once every 4 or 5 days, I take a look at it to make sure it's working. If it's underneath a cabinet hidden away, I wouldn't be able to do that. I'm sure I would forget about it unless it was emergency. But I don't know. That may be an OSHA regulation. I am not 100% sure. But you know what? I'm happy to find out, Sue. I'm happy to find out. And maybe we can get the answer by the time Megan sends out the email.
Absolutely. Okay, great. We have Jeannie, and she says, can you please highlight differences in CFAB accreditation requirements versus patient care accreditation requirements?
Certainly, that's Jeannie, right?
Yes.
Okay, Jeannie, great question. Yes, we were focused today on patient care accreditation. CFAB accreditation, the Central Fabrication Accreditation, is a whole different story. We have a lot of the same documentation, but obviously, since majority of them do not see patients, there's a lot of differences itself. One of the biggest differences is We mentioned at the beginning of this that the surveys are unscheduled and unannounced. When we do CFAB accreditation, because it is not regulated, it is not necessary. The CFABs are doing it because of best business practices to get accredited with the same organization, ABC, that accredits the patient care facilities. They want to be on the same group with them, in the same line with them, which is great. The surveys are scheduled. They are announced. We work with the CFAB staff prior to the survey. We help them prepare to make sure that they're going to pass this survey, to make sure that everything is in order when the surveyor shows up. For a CFAB, we're going to schedule it. We're going to call the CFAB once they feel like they're ready. We're going to call them and say, hey, Mary, what does Tuesday at 2 o'clock look like for you? Will that work for you? Will you be prepared for a surveyor to show up? And if Mary, who's the owner of the CFAB, says, no, that day is not good, we need another week, then ABC will say, great, take another week and let me know when you're ready, and then we will schedule that. And some of the standards are different as well, because it's more manufacturing in that area. But actually, we have our podcasts. Our podcasts are called Credcast, and they're available off of our website, and they're available on
I was just going to mention that.
Yes, we have CFAB accreditation. Matter of fact, one of the last two podcasts I did, that really talented host, was on CFAB accreditation. So please feel free to go back. That's only about a 17-minute podcast. So feel free to go back, and there's a lot of specific information on CFAB accreditation. But excellent question again.
Yeah, absolutely. Smart. They can find that on our website. We do have a podcast library where we keep all of our episodes that we've done, so you can check that out there. And let's see, we've got another question from Michael, who's asking, how are we informed of the 4-week window for the site visits?
I'm almost positive, and Michael, don't hold me to this, I'm almost positive you'll receive that by hard copy or an email. They'll give you the window, especially now that we're in the COVID issue, and they will do that. We will check with Tammy again. Tammy knows that for sure, but I'm not exactly sure how they communicate that with you, but they certainly will communicate that with you, and we'll be able to find that out as well. I'm jotting down a note. Michael, I'm jotting down a note for that also.
And then our last question that we've got in here is from Carolyn, and she wants to know, so our fire marshal had us, so she's kind of chiming in about the question we had about the fire extinguisher.
Do it, Karen, do it.
So she says that her fire marshal had them put their fire extinguisher out front on the wall.
Okay, so it was out in the open.
Yeah.
And her fire marshal did that. I can't speak for the fire marshal. I think that makes sense, but we will try to find a for sure answer. But Karen, thank you very much. That makes sense to me, but I can't say, I'm not an expert on OSHA or what the fire marshal says, but it does make sense. At least
we had one other question come in. We'll go ahead and answer that. I think we're a little past time, but I think if everybody that wants to stick around, we'll go ahead and answer a couple more questions. Sure. So this one is, does Medicare actually require ABC accreditation for a facility and for a practitioner?
It depends on the services you are offering. I don't have that memorized myself. We can find that on CMS website or the ABC website. And we can, if you send me an email, I will make sure I get the right person responding to you. Okay. Once again, my email address is jlawson@abcop.org. JLAWSON@abcop.org, which I'm going to put that on the next screen. So you can just take a look at the next screen. I'm not sure. It all depends on the services you are providing.
Right. So we know that there's mandatory accreditation for pedorthics and mastectomy, but depending on what you are providing.
And depending on what you're providing in O&P, yes. Some of it is required and some of it is not.
Right. And as far as practitioners are concerned, Jim, so practitioners are certified with us, or they can also be certified with another credentialing board. I know that there are stipulations about there being at least one certified individual on staff for particular services, and that affects your accreditation. Do you want to talk any more about that?
Yes, it does, and it depends on, and Megan, exactly right. It depends on, once again, what you're offering, what services you're providing, who needs to be there, who needs to be certified or licensed, or basically we're using the term credentialed for practice itself. And I think that's basically an entire another webinar. It gets real, it gets deep into information, it gets real specific depending on who you're able to bill. If you're a complete cash provider, that's a whole different story. But if you're billing Medicare, if you're billing insurance companies, then you will need to be certified.
Right. So if whoever asked the question wants to provide some more specific information about exactly what they're doing and who they have on staff, if you want to send an email to either
Sure.
accreditation or to Jim directly, again, we're going to have that information up at the end,
Well,
and
here,
we'd be happy to answer it.
let me put this up right now. There we go. Oh, we're still doing
Yes,
questions.
this is our reminder just to let everybody know that we will have the recording available 1 to 2 days, hopefully by Friday, up there on our webinar library, as well as in a follow-up email. And we'll also have the link for the quiz. And this is the link itself, if you feel so inclined to jump on it before we send out the follow-up email, or you have a chance to go to the website, you can actually copy it. I put it in the chat box for everyone so that you could actually use your cursor and copy it out, put it in a web browser or on a notepad if you want to do that. But again, don't worry if you don't get it today from here. We will send out a follow-up email and have it available to everybody as well.
If we do have a few more questions, I apologize. I just wanted to get to the screen. Here's my email address. That's all I wanted to show right now, if you would like that. Are there any more questions, Megan?
There aren't any questions. We just got a thank you. And so again, we thank you and everybody for attending.
Thank you very much. It's been an honor to spend the afternoon with you all. Thank you very much. And once again, if you have any questions, do not hesitate to reach out, okay? And if I don't have the answer, we will get it. Megan and I will get the answer for you. Thank you.
Absolutely.
You have a wonderful day.
Thanks, everyone. Bye-bye.